Welcome everyone to today's webinar, How Flagler Health is Working Toward a Frictionless Patient Experience. On behalf of Becker's Healthcare, thank you for joining us today. Before we begin, I'm going to walk through a few quick housekeeping instructions. We'll begin today's webinar with a presentation, and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At any time you don't see your slides moving or have trouble with the audio, try refreshing your browser. You can also submit any technical questions into the Q&A box. We're here to help. With that, I'm pleased to welcome today's speakers. Paul Viskovich, Chief Executive Officer, Health Elite, and Gina Mangus, Vice President, Strategy and Business Development with Flagler Health. Paul and Gina, thank you both for being here today. And Gina, I'll turn the floor over to you.
Thank you, Brian, and thank you everyone for spending some time with us today. I'm excited to share our digital transformation journey with you. I'll be speaking quite a bit about the journey itself that led us to where we are today, and Paul's going to get into some more functional applications of the technology. Before I dive into what we call Flagler Health Plus Anywhere, I'd like to provide just a little background on Flagler Health Plus. So Flagler Health Plus is a total care enterprise aimed at advancing the physical, social, and economic health of the communities we served. We are headquartered in St. Augustine and have close to 20 locations across Northeast Florida, including some walk-in clinics inside Publix grocery stores. Flagler Health Plus is an outgrowth of Flagler Hospital, which is a nonprofit 335-bed hospital that's been serving the community since 1889. And so when we talk about physical, social, and economic health as it relates to consumers, this is what we mean. The physical health component is obvious. I think the only thing to call out in this area is that we, like many health systems today, are focusing on keeping people well rather than just treating them when they're sick. And our digital roadmap had to really contemplate this. As it relates to social health, we're doing a significant amount of work in that space. Part of keeping people well means addressing those social determinants of health. So we established our own social health organization. It's called CareConnect. This is a unique model where the team at CareConnect provides care navigation for clients being serviced by more than 65 local agencies. So whether a person needs food, housing, health insurance, prescriptions, or mental health services, CareConnect serves as a unified intake process. So our end goal with our digital strategy is to move all 65 local agencies onto our platform, providing that seamless experience not only for the clients, but for also the members of CareConnect as well as our own team. And care navigation actually occurs on that platform. And finally, economic health. It's important to us as we look to help area employers reduce their healthcare costs. Wellness program with device integration and curating destinations through Flagler Health Anywhere really play a key role in our ability to fulfill that part of our vision to improve economic health for the communities that we serve. And so our enterprise strategy is to advance the health of the whole person and the communities around them, ultimately transforming what was once a typically 4-day hospital stay or an annual physician visit if we're lucky, to a 365-day-a-year relationship. To achieve this, leveraging technology and removing friction from the experience was critical to us. Supporting this strategy is having the right suite of services that deliver the right care at the right time at the right place, and putting access to all those services in a consumer's pocket. And that's what we've really done with Flagler Health Plus Anywhere. So the story of our journey really began with the support of the Digital Health Collaborative. As with executing on any strategy, we needed to do some validation. You know, our ideas appeared to make sense to us on the surface, but we had the opportunity to work with the collaborative to really validate through research. So the Digital Healthcare Collaborative is made up of thought leaders across the country, related to industries like healthcare device industries, payer side, hospital side, all of us working together to do research on how we best reach healthcare consumers, much in the same way that other industries are doing that today. And so one of the other benefits of the healthcare collaborative was that we had access to the research of the Consumer Collaborative, which had clients in it like Target and Disney. And so we were able to really leverage all that research together and layer that top-level research onto what we really wanted to know at Flagler Health Plus. And so the engagement we took with the collaborative was around the last 3 years of work, really talking about behavior change, consumerism, intelligent next generation experiences, and my favorite, moving from stupid, dumb, smart to genius technology in healthcare. And so we were able to kind of come up with 10 really big ideas on how we thought that we could transform healthcare. And we did a lot of research, but this was one of my favorite deployments of that research. Is the collab talked to some consumers and gave them a figurative $100, and they described all of our 10 ideas to those consumers. And they said, if I gave you $100, how would you spend the money? What would you invest the money in? And it's really interesting to look to see how they answered, because this is pre-COVID, so this was quite some time ago, but the number one was video chat doctor visits. That's where they'd invest their money. And then the next one is location alerts. And this was really one of our ideas that we felt could really help modify behavior change. There's a lot of research around delivering the right message at the right time and when the person is at the right place. So the idea behind this is that if we know through our EMR that a patient is diabetic, for example, and they are also spotted via location alerts at Dunkin' Donuts, we could deliver a message or a nudge to think about those healthy options that are on the menu and even suggest what they may be. Or let's say someone is a smoker and we know that they tend to cave in if they're at a certain place, or they pull into a certain Chevron station is where they typically buy the cigarettes, and they've agreed to let us send them those alerts, those reminders at the right time and when they are at the right place. So it was interesting. Some people right away felt, well, that's too invasive. That on the collab we would call it the creepy factor. But people were willing to put their money behind that, and they felt that there would be an advantage in that. And you'll see later with our app, the first step that we've deployed the location alerts is more around the office experience. So we know that the patient's pulling into our health village. We can send them a message that the doctor is running behind, or, thank you for being on time. Please make sure you got 2 pieces of paperwork you still need to fill out. So that really is a transformational experience for the patient. And then the third item was the centralized medical record. And I'm going to talk a little bit about some more research around that, what that centralized medical record really means to the consumer. Because us in the healthcare space kind of look at that a little differently, and what's important to us versus what's important to the consumer. And so you can see, where they put the rest of their money. AI, I think, is a little scary when people think about deploying it to healthcare specifically, but we do plan on deploying some AI to actually answer some of those most common questions that happen within the secure messaging portion of the app. And so on the next slide, you'll see what the key findings of the research that we did in collaboration with the DHC were. Number one, consumers want to go beyond basic health data to track goals and receive health education in one place. It was interesting, if you actually look at that data, the most important things for them to watch were not necessarily, what my last lab results were. It was more about my activity, my weight, those things that might not necessarily be in the health record itself. Number two, 85% of people find value in a single source for all health information. So that's directly linked really to number one. So when we talk about our roadmap for our app, it was really important for us to make sure that device integration was included. And Paul will show you more on this, but today I can sync up my Apple Watch, my Fitbit, my wireless scale, my blood pressure cuff, and a number of items with the app. And that information is synthesized in one place on my health board, actually with my health record information. So it's just at a glance whether I was in the hospital, whether I had a physician visit, or whether I've just been exercising or not exercising, or taking my blood pressure every day for the last 30 days. That is is an ultimate outcome of our research and development. And then lastly, chronic disease patients feel that the most important types of data for improving most milestones is directly tied to their personal and emotional well-being versus data measuring their physical health. So again, when people think about a unified view into their health, they're thinking far beyond what we're capturing in a traditional health record. And so when we hear about patient portals and the use not being what it needs to be, it's because we're not really putting the information sometimes in an easily accessible way, and two, not necessarily the information that the patient is most interested in. So these key findings really played a key role in the development of our digital point of view. And so we synthesized all the work that we had done and determined that our goal was to simplify the healthcare experience for everyone so consumers can get the care they need, the support they want, and the inspiration to achieve better health. And really, as we talk about the transition from fee-for-service to value-based care, the inspiring patients to make changes to their routines and adhere to their medication requirements and really make those healthy lifestyle changes they need to do. It's that inspiration piece that we think that we are capturing that no other organization is really doing in collaboration with all the other data and information and activation that we are going to accomplish. So once we had our perspective, we had to think about how are we going to execute on this, right? So the first option was to buy off-the-shelf products. We did a lot of research and we looked at everything out, not everything, most of what we could out there. And there was not a singular product that was that could today accomplish what we wanted to accomplish. So what we could do, which many systems do, is get several different pieces of technology and try to cobble or weave them together. Secondly, we could try to custom build something in-house, hire and build our own technology development team. Is that really our core business? Is that what we're the best at? Probably not, and that would be a big investment on our part. So option 3 was to partner with a disruptive consumer health tech company and become a partner and really create an innovation lab, where we're going to co-develop this product together. What a technology company needs is a healthcare partner to test things with, and what we needed was some more expertise. And we did have an aligned vision. Healthfully had a product, but they also had a roadmap on how they wanted to advance that product, which closely aligned with our roadmap at the time. And so it was really a perfect marriage. And so together, we partnered to create this unified experience across all care settings in the palm of our consumers' hands. And so we have, and Paul will go into more detail on where we are today, we have unified that patient portal experience. We have the walk-in care check-in available. We have get in line functions. So if you look across the continuum of our enterprise, we do still have some work to do, but today we have achieved much of what you see on this slide. And then on the next slide, you can see in detail we have broadly deployed across our enterprise the Healthfully solution. So in the left box, you'll see the focus on the provider and the administration side. So there's a lot of work shoulder to shoulder with our practice managers and physicians on how we could best meet their needs. The last thing they want to do is have to document something in an EMR and then get in a different system. And so how are we going to make this easy on them and seamless for them to know the patient's checked in, the patient's filled out their paperwork? How does that information flow from Healthfully to the patient record? And what do they want to flow to the patient record? The remote device integration, what kind of data do they want back from the patient? If I'm having them, weigh daily, do I want that data viewable on the dashboard, or do I want that in the medical record? So we've made all those decisions shoulder to shoulder with our clinical folks. And then on the consumer side, this is what they're able to do today. So beyond just scheduling an appointment, having their virtual visit, and paying their bill, which is pretty cool. They can do all that in one spot, right? They can schedule the appointment, They can make their payment, they can see their doctor, all without having to navigate into any kind of different system. And then beyond that, like I said, they can sync up all of their remote devices that they want to. They can have health coaches meet with them online. We're providing those nudges, to-dos, daily to-dos. Right now, one of our products that we were able to deploy in tandem with this is our COVID back to work and back to school solution. So we have thousands of people across our community every day logging on and testifying that they don't have symptoms of COVID before they go to work or school. So Flagler College here in our community was one of the only colleges that never closed their live classes or their dormitories throughout COVID. They leaned on our solution, which is part of this overall unified approach to digital. So from a patient acquisition strategy, we were able to pull in all those students and all those employees of businesses who had to download our app, and they became very familiar with how it functions. And then if they were identified with symptoms, they could simply select to see a doctor and have a doctor visit right on the app through a virtual visit with one of our physicians. So we were able to gain a number of new patients simply by deploying this back to work solution in our community. And then, as I mentioned previously, the community services provided through Care Connect. We had a local mental health provider. We all know that COVID severely impacted people's mental health, and people were unable to access. There were many offices closed, not willing to see people in person. So an area mental health provider actually used our platform throughout COVID to see their patients. And then, obviously, you can just see all the areas that the services that we're providing. And like I say, Paul will dive more deeply into the technology piece of this, and then you can see that through the use of APIs, we've been able to integrate this experience. So whether as I said, had the hospital stay, the outpatient stay, an urgent care visit, which we currently are partnered with Amwell for some of those urgent virtual care visits, and then PAYA, that information is flowing back and forth regarding the payments for the patients. So with that, our goal was to create that frictionless experience, and so it's important to know what our patients are saying. We do send out a survey out when someone leaves the office, and also we were surveying those folks who were coming through our drive-through test site. We had a get in line function put into the app when we had our drive-through COVID test site, so patients could pre-reg on the app, and then we had a fast pass lane where they could drive through more quickly for those who had downloaded the app, again, a patient acquisition strategy, and get in line and have faster service. So the responses we were getting, the overall rating of the app from those surveyed is 4.84 out of 5 stars, and the satisfaction with the visit at the office or through the drive-through test site was over 97%, as you can see. And these are just a few words from those patients who have utilized the app. These are the words that you want to hear: efficiency, excellent platform, happy to have virtual access to my doctor, fairly easy user process, got through, everything flowed smoothly, happy with the virtual doctor experience, and it's easy to use. And so easy is not something we often hear in healthcare. And that was definitely one of our goals, to be able to ensure that our patients and consumers and new people being introduced to our health system were introduced in a way that was going to improve their health and well-being and leave a good taste in their mouth about their experience with Flagler Health Plus. I know I spoke very quickly. I had a lot of slides, and we want to leave plenty of room for questions and answers at the end. So I'm going to let Paul really dive more deeply into the technology itself.
Thank you, Gina, and thanks to everyone else for joining today. I'm Paul Viscovich, CEO of Healthfully. Our tagline is a simpler way to better health, and our mission is to remove the friction for the patient or consumer in their health or wellness experience. So what we do as the technology partner is we provide enterprise organizations like Flagler Health with a white label comprehensive technology platform to engage and empower their consumers and their community on their health and wellness journey. And if we look at the wheel there on the left, we've tried to create a broad, universal platform that covers everything that a consumer needs to do to interact on their health and wellness. So they only have one place to go to connect to get a job done for health and wellness, and one place to go to get the information they need on those sorts of things as well. And in the palm of the hand there, you see what we call our landing page, where people see the tasks they need to get done and the appointments they've got coming up. So for our enterprise customers, they can get their own branding, and Flagler decided with Flagler Health Anywhere. So we manage that branding on your behalf. The different app store names in Google and Apple, and different URLs as well as branding, colors, and logos. So if we look at sort of different patient engagement models, and we look from left to right, there's a number of different approaches that are out there in the market. The first one is like that digital facade, which is really like many hospital or health system websites, is they're not really integrated with care delivery, or if they are, it's very siloed. And then we get to digital front doors, which is probably where most patient portals fit, in that you can integrate with some services in the organisation, but it's lacking the integration across different care settings typically. Because it's not deeply integrated, it's not really removing, in our view, any friction from the patient experience. And we believe to basically remove the friction for the patient and make it interoperable about all care settings, we really need to do a transformative patient engagement solution with deeper integration to the enterprise systems to achieve that. And Healthfully provides a solution there on the right, which provides that transformative consumer engagement. This is a fairly detailed slide. There's a lot there. But if we look at that, a consumer uses one branded app regardless of the service. And that's whether the service is provided by the health enterprise or by one of the health enterprise partners. Because a lot of health organisations these days have services that are provided by partners, whether it's a joint venture or just a collaboration. We can provide that unified engagement across all those different partners and different care settings. So that means if you schedule an appointment for an in-office visit or a virtual visit for someone in primary care or pediatrics, it's going to be the same as if you engage a health coach or a wellness visit or a behavioural health visit. It's going to be consistent, going to make it easier for the consumer to get the job done and to interact. So if you look at the functionality, and then when we look at getting aligned for things that are like a deli counter type things, getting aligned for a lab test, getting aligned for urgent care, it's a consistent approach. A simple example, you go to primary care, then you've got to go to the lab. Instead of doing the paperwork again, you can just get in line to the next thing, and it's all seamless and frictionless for the consumer. And there's redoing of paperwork, not redoing of getting a line and waiting. You can do this seamlessly. And this is available on Apple, Android, and the web, so any connected device can be used for this platform. We also have a number of provider tools on the left, and we call this the practice workspace. There's a lot of service providers like social workers, wellness, people who provide wellness and care management that don't have extensive tool sets. So we have extensions on our platform to supplement what they have, things like calendars, case notes, televideo, and case management. So for sophisticated EHRs, clinicians can stay in the EHR. For other services that are more specialised that typically don't have that full EHR support, or in the wellness space that don't have the full EHR support, we provide those tools to provide that seamless experience. We also provide flexibility, for example, with virtual visits. And Flagler is an example. They had Amwell and they're using Online Care Group to supplement their clinicians. So we've integrated the Amwell Consumer SDK as well as our own virtual visits. So the virtual visit experience is the same whether it's using an ML doctor or one of your own doctors or one of your own wellness coaches. So we offer that flexibility so you can offer a consistent experience very broadly. So as you know, the telehealth platforms only offer services for credentialed physicians. The other thing is, as well, is the consumer persona is expanded through consumer-driven pathways and data collection across all the services, as well as the personal activities and devices. So we get other useful consumer persona information to help better engage with the consumer about their preferences and other relevant information. Here's some examples of some screen images of the app and typically what it looks like. We've created a very clean and compelling user design that's very simple and intuitive to use. On the left there is the landing page, which shows my to-dos. Here I've got some risk assessments and PHQ-9s to answer. I can get care or I can see my scheduled visits. Also, we've designed it so you can have one login but still connect to a number of different patient records. So if I'm a mother, I can have all my children there and just simply clicking on the next icon on my children, I can see their actions and their visits and so forth. So it's very efficient in the family dynamic. Scheduling a visit, what type of visit, selecting someone, and then on the right there, you've got an upcoming virtual visit. There's a copay you need to pay. You can pay that online. You can join the video. As you can see, it's very intuitive and clean. Looking at the next slide, we have notifications. Those notifications are user preference, push notifications, SMS, email. Also geolocation nudges. Gina mentioned that. You get within 500 feet, 1,000 feet, whatever you configure of your appointment, your physical appointment. The system knows that and will say, you've reached your location, do you want to check in, as an example. Those nudges are continuing to get more sophisticated as we continue to roll out. Example of what a virtual visit looks like on a phone. We have messaging with the practice and routing for those messages of who they should get to. For example, you could have a wound there and you could show a picture of a wound or a swelling. So that interaction is there. That all goes into a queue in an inbox, so that can be managed by a team or individual. We also have what we call health communities. They are like Facebook groups, but HIPAA compliant. It's a way to inform and engage people and also get peer groups together to collaborate, such as a dementia support group for spouses, a diabetes group, youth behavioural health group, just examples of what we deployed, a wellness group. We also are a certified patient portal. There's an example of the patient portal categories. And the second slide there is an example of a lab result and how the ranges are displayed. As you can see, it's very clean and intuitive. We also have integrated a lot of device data for us. So from a consumer point of view, they can track their steps and distance and BMI and weight. We've integrated a number of specialist devices. SpO2 was a requirement for COVID. When people are getting discharged, they get provided SpO2 device, and we can continue to track the oxygen levels remotely. And that's an example on the screen on the right. So we've got a growing list of devices that are continuing to be, and measures that are continuing to be integrated and deployed. So that's available for the consumer to see, the consumer's family to see if that consent is provided, and obviously for the care team to see. So there's a number of approaches we see to deploying this sort of technology on transforming consumer engagement. And with Flagler and Gina's team, we did a consumer transformation. So we jointly established an innovation partnership with an innovation lab, and we created a unifying digital consumer experience across the enterprise. And that was the approach we took at Flagler. But we've got other organisations that are taking a more stepped approach to that, a progressive approach as we call it. And we say think big, which is this transformative vision, but start small and scale fast. An example of that, we've got a number of organisations that say starting with concierge medicine. So they have a new concierge practice where they're providing a high level of customer service to a particular group, and they deploy initially the concierge solution on that, or it's primary care, or it's behavioural health, or it's wellness, or transitions of care. So with that, you can have a progressive implementation. So over time, you still end up at the same goal of a transformed consumer engagement for the enterprise, but you're doing that on a progressive approach. And both of those approaches are valid. It's just a different way to do that. As you know, not all health organisations are able to engage on a top-down approach, more of a bottom-up approach. So thank you. That's a quick summary of the technology. I think we'll hand back to Madeline and the team for a Q&A session.
Yeah, absolutely. Thank you, Paul and Gina, for that great presentation. And we will now jump into today's question and answer session. So as a reminder to all our attendees, you can submit any questions you have by typing them into the Q&A chat box on your webinar console. We've had a bunch of great questions come in already, so appreciate all this engagement. Paul, the first question here I'm gonna put to you. The attendee asks, what's different between your patient engagement solution and the ones offered by fully integrated EMR solutions like Cerner and Epic?
Okay, well, thanks for that. I think the big EMR vendors have an inherent vendor bias towards promoting the EMR software, which is their core business, and as a result, I think their patient solutions become an extension of the basic clinical process silos. And they typically have difficulty scaling down their solutions for small providers like health coaches, wellness, and remote care workers and the like. And as a result, excuse me, most of the big EMR vendors have chosen a partner-based strategy to address patient engagement. And this typically includes a number of different vendors to satisfy the different use cases. And therefore, the unifying experience, common look and feel, the interoperability all suffer from a multi-vendor approach. And I think it's the same argument that we used to have 10 or 15 years ago between best of breed for the hospital or all-in-one system, in that we see ourselves as an all-in-one solution for consumer engagement, which provides that unified experience, as opposed to going a best-of-breed approach and bringing something together that suffers from those different look and feels and difficult to unify. So essentially, we see EMR vendors as a partner and not a competitor in that regard. And we're currently certified development partners with Epic, Cerner, Allscripts, Greenway, and a number of others.
And this
Thank you, Paul.
Gina,
go ahead, Gina.
Could I add on to that? I would just like to,
of course,
the patient portal products and the offerings of the EMRs don't have this cohesive nature where the patient is inspired to interact with the app regardless of whether they just had an appointment or an upcoming appointment or a hospital stay. We have those online communities which Paul touched on very briefly, but an example would be we used to have a Facebook support group for our weight loss surgery patients. So after you have weight loss surgery, as many of you know, the patients have a lot of concerns. They need to take their vitamins. They might experience hair loss, sagging skin. How do they deal with all those things? And the best answers are always from the people that have also had surgery. So we've had a successful Facebook support group for years that's moderated, but people became very uncomfortable with the security of Facebook over time. So being able to have those Facebook-like communities inside a secure app is definitely a unique feature and something that we are leveraging. You can have your diabetes support group on there in a secure environment. We offer health coaching and online classes and all that right inside the app. And then just one other point is the family care circles that are embedded in there. Sometimes people think that people who are older may not be tech savvy, which I believe is actually research is showing the fastest growing group on Facebook right now is people over 65. But, if someone does not, feel comfortable with their smartphone, what we have the ability to do is have the whole family included with their own accounts. So I could see my mom's information, I could book my mom's appointments, but I'm booking them as me. I'm not sneaking onto the portal pretending to be her, which is often what happens with the current patient portals.
Well, thank you, Gina, for weighing in there, and thank you, Paul, for both of you for making some of those distinctions there and sharing some of that added clarity with our attendees today. Gina, this next question is addressed to you. So the attendee asks, will you further elaborate on how this digital strategy aligns with your hospital's approach to new patient acquisition?
So I touched on it a little bit in that we have offerings within our app that go beyond doctor's appointments and things. So if our COVID application, anybody who needed a COVID test could download our app and then go through the drive-through test site and the Fast Pass. If someone needs an urgent care visit, they can download our app and have a quick urgent care visit. They may not necessarily be in our system. So at that point, we have their email and their data and information, and we have automated, ways to reach back out to that patient, letting them know there's a primary care doctor near you. So it's really building up that convenience structure and a way to get patients on the platform. The communities, we're offering health courses, health coaching, cash pay services, all in the app to anyone who's interested. So those people do ultimately become patients of our system once they've interacted with the app for other services. And that's also related to our Care Connect programming with 65 local agencies. Part of Care Connect, the mental health enterprise within our community that's on the platform is not owned by us, but they have all their own patients downloading our app to have their mental health appointments. So how convenient is it for me now that I have my mental health counselor on this app for me to find a Flagler primary care physician that I can easily access and interact with in the same way?
Yeah, absolutely. That makes a ton of sense. Appreciate that, Gina. And this next question, Paul, I believe you sort of touched on this already in a previous answer, but this is an attendee question that I think it's probably important that we just, shed some more light on it. So the attendee asks, does it matter what EMR is being used?
No, it doesn't. Some EMRs, we've completed all the integrations and some we're still working on. So they are getting prioritized as customer requirements determine. But, prior to starting Healthfully, much of the Healthfully team had been responsible for delivering the technology for many of the health information exchanges across the country. And, we integrate them with almost every EMR on the market today. So we understood that. So we built Healthfully with EMR interoperability as a core capability of our platform from the start. And with that extensive experience we have in EMR integration, we don't see that as a challenge. It's just part of if it's not an already integrated EMR, it's just part of the deployment process as we continue to go across the market.
Excellent. Thank you, Paul, for addressing that again. And Gina, I believe this next question gets at something you shared during your portion of the presentation. The attendee asked, the idea is presented in a $100 activity primarily focused on treatment. For consumers with chronic conditions, did you offer an option for improving self-care and informed decisions?
I think that wasn't a specific idea that we brought to the table. I think it was more about the activation, the location settings, those sorts of things on how we could nudge and encourage people with chronic conditions to make those smart choices. Like I mentioned, the diabetes patient and where they are. And another example of that application would be for mental health. If we can know that someone typically leaves their house every day and they haven't left their home in 2 weeks, we can get a notification to reach out and check in and see what's going on. The app also has survey function that's very robust. So we touched on that very briefly, but customized surveys for specific patients they could get daily around their daily habits that impact their chronic disease state.
Thank you for tackling that, Gina. And then I believe this next question is addressed to you as well. Do your community providers utilize the app or only employed providers?
So currently it's our employed providers as well as a local behavioral health company that is not our own. Those are all community-based providers. We are working with a number of our community providers to move them over to the app. Cardiovascular is a big one with the remote patient monitoring. They're very interested in leveraging the technology to be able to help keep track of their patients a little better.
Thank you, Gina. And this next one's addressed to you too, so coming right back at you. The attendee asked, can you please discuss changes to improve price transparency, estimates, out-of-pocket, and the digital payment platform? How did these changes impact your collections of bad debt?
Yeah, that's a big one. We actually have a meeting upcoming with our VP of Revenue Cycle to further investigate how we can leverage this technology to improve that even more. I can say in the outpatient setting right now, because we are having people pay online and we're able to nudge them if they haven't paid. We can send them a to-do to pay their bill via the app. That is improving collections in the primary care setting. So we're trying to look at other ways that we can enhance that even further. The price transparency piece is a challenge for all of us. We're all just working through that the best that we can and helping people understand more. The challenge with that is more on the inpatient side. How do we predict, what that heart attack is going to cost that patient, not knowing yet what all their treatments are, what they're going to need over the long term. So the price transparency is on our roadmap. We have been working with the Digital Healthcare Collaborative. Honestly, that's one of those things we're trying to figure out on how we can better serve our patients in that way. But I will say on the outpatient side, we're definitely have tools now that we can nudge for payment that we did not have before that is very effective and non-invasive. It's better than the phone call, in my opinion.
Excellent. Yeah, that's great to hear on the outpatient side, and definitely price transparency. We hear it all the time at Becker's about what a challenge that is. So Gina, another attendee asked, are your providers concerned they could lose revenue by giving them access to providers outside of Flagler?
We would love for our own physicians to be our sole urgent care provider, but since we're providing care 24/7, we do have to lean on the online care group. The hybrid model is that our physicians have the ability to log in if they want to participate in those urgent care visits. Unfortunately, that's just not been something they've been wanting to do to this point.
Got it. Thank you, Gina. A ton of great questions coming in. Love to see all this engagement. Paul, this next one's for you. So, Paul, what technologies are you using for the integration/applications?
We are using interface engine technology and EMPIs. Our integrations are typically APIs, HL7 and 5 type standards that we're using with most of the enterprise systems at the moment.
Got it. Thank you, Paul. And then Gina, the attendee asked, can you speak to the solution on the family circle of care and how it's helped in providing services, especially to your older population?
Well, I can say, particularly being in Florida, we have a lot of patients whose family lives in the Northeast. And so being able to engage very easily with the provider provides such peace of mind to the children, the adult children of older patients. And again, like I said, with the patient portal, even with my own parents, I would find myself like trying to log in as my mom for one of her doctors who's not one of ours. And this makes it so easy because in our app, I can log in as myself. I can see whatever my mom gives me permission to see. and communicate directly with the physician through secure messaging, not just the physician, but the office staff, check in. And one of the really neat things that we can do are those surveys and nudges can go to my mom, but they can also go to me, and I can get notified if she's not, say she's supposed to do a daily depression screening, I can get a to-do in my box that says, check on your mom, she didn't do her screening. So there's a lot of really interesting nuances that we can do for that family circle. And then taking the friction out for the pediatric patients, making sure that mom, if I've got 5 kids, I only have to change the name and date of birth. I don't have to go in and fill miles of paperwork for each of those children individually. So really trying to sit in the consumer seat and how we can better serve them as a family.
Thank you so much for touching on that, Gina. And then the next attendee question is, how many post-acute services are connected here, if any? Home health, DME, hospice, et cetera.
We do have our own home health provider. We have not deployed that fully yet. We are still in the implementation stage with our home health care workers. But having the pulse ox and some of those other opportunities for device integration is going to be extremely helpful for them.
Excellent. Thank you, Gina. And Paul, I'd love to get you involved on this next question. So the attendee asked, can this mobile app learn from healthcare consumer demographic and clinical information and offer care recommendation and care education recommendations?
Yes. So we're on that journey at the moment. I think Gina mentioned part of the healthcare collaborator was dumb, stupid, smart, genius, and our app is on that journey in different parts of that. So we're continuing to add intelligence to the platform and automation to the platform as we continue to deploy. So depending on the area, there's some sophistication in that now, and other areas are still getting improved. So that's part of the roadmap. It's an ongoing process of continuing to add intelligence to the platform, and that's one of the areas that we're focused on.
Great, thank you so much, Paul. And we'll take one more question here. Gina, it is for you. So given you're based in Florida, can you speak to the value for your elderly snowbird population? Has this solution made an impact on their care with the family circle of care you spoke of? So revisiting that family of care that you touched on before, but I think that's a great one to close out on.
Yeah, again, I think the great thing about this solution is that it is inclusive, and we didn't really talk about rewards, which is the next phase of our deployment. And so now that we have the data around someone's weight tracking, their steps tracking, we are looking at our next phase of how we reward those positive behaviors. And not only will we be able to reward them directly to the patient or the consumer, but also we're creating a structure where the family can take part in those rewards as well. So I would get notified how my dad hasn't smoked in 5 days within the app, and then I, as his child, would have a chance to come up with some rewards for him for doing a good job. So I think just the overall approach, and yes, being in Florida, knowing that we are eliminating a lot of that discomfort that adult children of elderly parents have who are living far away from them. How can we include them more? We learned a lot through COVID, obviously, how to do that better as well, how to use technology to help people feel included and know what's going on. And as healthcare providers, we all know the biggest miss we have is communication. And this solution is really designed to empower and engage the patient, the family, the provider, the office staff in new ways that they're approaching that communication. And one thing I didn't mention previously is really sometimes organizations get concerned about those secure messages. Oh, we can't be answering all those people. But really that results in clearer, quicker communication and less phone calls. If you think about the calls that sometimes you get from some of those patients that could take 20 minutes, which you can answer in a quick, secure message. So I'd say the family orientation of the solution actually mirrors our physical health villages, which are designed to focus on physical, social, and economic health. We have gardens and performance stages and all those things to bring the whole family in to feel good about their healthcare experience. And when we started this project, we actually called this our virtual health village because we have physical health villages, and now this is really that virtual health village to meet all the family's needs.
Excellent. Thank you, Gina. A great place to close off. So Paul and Gina, thank you so much for that excellent presentation. And I also want to thank Healthfully for sponsoring today's webinar. To learn more about the content presented today, please check out the resources section on your webinar console and fill out the post-webinar survey. Thanks for joining us. We hope you have a wonderful afternoon.
Thank you.
Thank you.